Greetings and welcome again to yet another, girl, who don't you know? It's me, Marilyn Green, the hostess with the THEE mostest, right? Okay, so let's get right to it. The first thing I want you to do, I really need you to go and like and subscribe, YouTube, Facebook, wherever you want to do it. Just do it. All right. Thank you so much for that in advance. Now, my guest that I have today is part of what I like to call pink voices. And my pink voices always comes every October when they say that breast cancer awareness should be known or talked about, right? But for me, it doesn't matter what month it is. Just know that understanding that breast cancer awareness is important and prevention is very important. So that's what we're going to be talking about today. And I have an amazing, well, how can I describe her? But when I first met her, I just like, oh my God. And then I started talking to her more, and I found out that she would be like a super perfect guest for my pink voices. So I'm going to introduce to you uh Jill Johnson. Jill, how are you?
Good morning, Marilyn. I'm so happy to be here with you today.
Yes, and I just love that. I just like Jill, okay? Something about her is just special. And when I started to talk to you, Jill, and you explained to me about what you're going through right now, I found it very interesting because somebody out there is going through something similar right now. So I'm hoping as you start to talk and tell your story that people will get a different type of hope and they'll have a different type of I can do this. Okay. So tell me, Jill. Now I know that I think you told me that you're in the beginning, or you are dealing with breast cancer at this time, and we all want to know, how did you get there? How did you find out what happened?
Sure, Marilyn. Well, I was recently diagnosed with DCIS, which is ductal carcinoma IS, which means it's a cancer in your ducts. I was diagnosed in July of this year. So, to your point, early diagnosis, and that's where I sit. But I think it's important for people to listen and understand how we got here. So, I'm a regular tester. Um, of a certain age. Let me just be honest. I just turned 60 in,
Yeah.
in September, so it's a milestone birthday. But even before then, I was a regular tester. I always had my mammograms once a year, always. And I have historically had dense breasts. I had a breast reduction surgery um, 20 years ago. And so in my mind, I was like, the doctor said, oh, you significantly decrease your risk of getting breast cancer because so much of your tissue is gone. Wrong. But that's the bubble that I sort of sat in, right? So, to me, it was
Okay.
always to check off the box, go get your test, go get your pap smear, all of your annual testing, just checking off the box. And that's what I did. So in November of 23, I took my test. I sat there and I waited, and they always come back, the clear notice, you're fine. We'll see you next year. This time it was a little different. The technician called me in after my test and said, the radiologist saw something and would like for you to go and get further testing. In my mind, I'm saying, all right, well, it's still the dense breast, so no big deal. So that was November. I went back in December to have the testing done. It was over the Christmas holiday, so the staff was a little quiet. The radiologist wasn't there. The person that was supposed to read my results, the doctor, was supposed to be in person, but because it was a holiday, it was all done on Zoom. So I had the
Mm-hmm.
conversation. She took all, they must have taken another 30 or 40 images back and forth, front and back, all of it. This is in my right breast. And I said, okay. She called me back and she said, well, we see a couple of things. We're not sure. They're very small. They're little spots. Looks like maybe it's calcification, might be in your veins, so in your arteries. So we're not going to really do anything, but we do want you to come back in 6 months just to be sure. And I said, okay. Again, in my bubble, I had a breast reduction surgery. There's breast cancer doesn't run in my
Right.
family. Nothing to worry about. Fast forward, July came. I'm still diligent because they told me to come back in July. Okay, well, I'm going to go back in July and we're going to test this again. You're going to go through it. They're going to come back and they'll say, yeah, no problem. You're fine. That didn't happen. After I took
Mm.
my test, the technician said, "Could you sit over there?" And we all know what that means. When we're separated, it always means something's not right. So she said, "Can you
Right.
sit over here? The doctor wants to speak to you." And I was like, "Okay." But again, I'm still in my bubble, Marilyn. I didn't think anything of it.
Right.
I'm still in my no, I couldn't. There's no family history. There's no nothing. Well, I sat in my bubble. The radiologist came back and said, it looks different than it did in December. There are more of those little white spots. So we think you should have a biopsy. And then I started to say, okay, this might be a thing, right? My bubble was
Right.
slowly shrinking. It wasn't much,
Shrinking. Yeah. Yeah.
definitely was shrinking, right?
This real.
It's
This is
this
real.
might be something, right? And so I
This is
said,
real.
okay. But still, I'm still still a little. No, they're going to come back and say it's negative because ironically, friends of mine, we're all of a certain age, we're all going through the same thing. Another girlfriend of mine, another soror of mine, she was going through the exact same thing and we were praying her through everything. And of course, she had her biopsy and no problem. It came back negative. So she was good. So I just assumed I'd be right along with them. Well, had my biopsy, and I will tell you if anyone's had a biopsy done for their breast, I
Oh.
this is just a sidebar. I laugh because you have to find humor in everything, right? Um, the machine that you have to do it on, the apparatus. I said only men could possibly have invented this machine. It's this big old table. I don't know, Marilyn, if you've had it or any of your guests have had it. It's a big
No, I've had it. I've had
right? So
it.
you big old table that you got to sit
This
and you got
table.
to put your boob in the table in the slot in the this and then I was like, this is
Yes.
maddening. Only a man could have thought of that. But
Jill, let's stop right there
okay,
really quick.
sure.
It is true. It's very, very uncomfortable. Your boob is hanging through a slot. The person, I'll just go on and go there. The person the doctor drives, comes in a little chair, a little
That's
wheelchair, and he is doing it while you're basically just sitting over, laying over, and it's just dropped down there. It's almost like milking a cow.
that's
Let's just get there.
Marilyn. That's exactly what it is, and they're moving and
It was
shaking,
like,
and then
what?
yeah.
Yeah, but go ahead, Jill. I'm
No,
sorry.
no, but
Yeah.
you are 100% right. It is the most. It's like almost those out of
Degrading.
there. It is really. If you think about
It's
it,
really.
it is. But I had to stay light because I didn't want this to overcome me. So I'm laughing with the technician and I'm the doctor. It's like, really, who invented this thing? But needless to say, and but what you also think about it, it's very it's amazing too because there was no needle. I mean, there was no knife, there was no cutting, there was no blood. The machine did absolutely everything. And
Hmm.
so I had the biopsy done, and she said my results would come back in a week or so. I was fortunate enough because I had an opportunity to do it either with a radiologist or a breast surgeon. I opted for the surgeon, and I was very
Uh-huh.
thankful that it was Dr. Addis. She's out of the breast center here in New Jersey, with Summit Medical Health. She was excellent and very accommodating and very sensitive and very, putting me at ease. But a week later, the results came back and she called me. I was actually on vacation with my cousin down in Alabama on the beach when I got the news. And she said it was positive. But she did say, I was at 0 stage. We found it early. Um, but it was indeed breast cancer and we want to perform a lumpectomy. And so I
Okay.
had the lumpectomy done in September 16th.
Wow.
So
This is so
it
fresh.
is.
This is so fresh. I can see your face now as you start to go back from the time when you first
Yeah.
heard, you know. But hearing it is something I cannot relate, but I can relate on this part. When we talked about the degrading machine in which they do the biopsy on, they had to do the same thing because it was the denseness in my
Hmm.
breast that they saw something and they wanted to make sure that it was
Right.
nothing, right? But I had to get it done February the 14th, 2003.
Mm-hmm.
And at that time, it was 2003. A lot of things was happening. I was getting remarried. My son was getting married. My son was graduating from college. You know what I did? I said, God, no, this can't be true.
Right.
No, no, I got too much stuff going on for this. No, no, you set all this stuff up. Now you setting this up. Where we going with this,
Right.
God? Okay, come on. You're like, what's up? So when I had to get it done, the bad part about it is the thought processes because February the 14th was on a Friday.
Mm-hmm.
So I had to wait the whole weekend.
Mm-hmm.
So I can only imagine just a little like a drop in the ocean, right? Of what you was going through. What happened? You had to tell your family. You had to what happened, Jill, then? Where did your mind
Well,
go? Where
well, this is the one thing that I always say, that that's why we serve a good God, right? And
yes.
I mentioned I was away on vacation. So my cousin, who's my sister cousin who lives in Atlanta, um, she called me probably the week before. She sort of knew what was going on, but this had really nothing to do with what was going on. But she was driving from Atlanta down to Alabama, to Pensacola,
Okay.
to the beach. And she's like, well, why don't you come with me? Because she was going to drive her grandchildren down. And it was a 5 hour drive. And I was like,
Hmm.
uh, oh, by the way, I'm recently retired. I always put it in air quotes. So I had a lot of time. I
Okay.
had free time. So I was like, you know what? I'm going to jump on a plane and fly to um, Atlanta and drive with you. God knew that who I needed to be with when I got the news.
Yes.
And so he ensured that I was with family. He ensured that I was with somebody who could support me. He ensured that I was in the environment that I needed to be in. And I'm forever grateful for that, because to your point, it could have been very different. She sat with me while I first processed the news. I'm a mom of two grown boys, but they'll always be my babies. I have a son, Jordan, who's 27, and a son, Justin, who's 24. It was important for me to ensure that they found out and that I told them.
Hmm.
So she was there when I shared the news with them. She was there when I shared the news with my husband. So it was, making sure that Jill was good, right? And there were special friends that I had to make sure that I shared that with them as well. And it was just important for me to be embraced and process the information. Um, the doctor wanted to see me the very next day, unfortunately, because I not unfortunately because I was away, I couldn't. So I had to wait almost another week before I could actually speak to the doctor, so she could break it down and tell me exactly what it was, what was the goals, the outcomes, what was next in the process. And so I had more time to kind of think about it. But I say that to say is that God makes no mistakes. Um, this was just a little bit of my cross to bear at the moment. I wonder
Hmm.
why. Um, and I only wondered why for a brief season, because
Okay.
we all are going to face trials and tribulations. Just because we accept him as our savior, that does not mean that there won't be trials and tribulations and things that we have to bear. But what we are rest assured on is who's going to walk with us in those journeys. I have
Yes. Yes.
100% faith that he has and continues to walk with me through this journey. So,
Yeah. That's great. That's great because we got to have something to hang on to. That's what
absolutely.
you're saying.
Absolutely.
I gotta have his hand, and his hand is gonna show up in different people. Your cousin, your family. This just the outright love. It's all about keeping your mind in perfect
Yes.
peace on it because he has it. He definitely has it. And so I think that sometimes, even in my brief little weekend, I had to hang on to what he told
Mhm.
me, right? The promises of God
Yes.
is yea and amen. I really had to hang on to that because when you start talking about our girls, and I'm talking about our girls, okay? When you start talking about our girls, they are equated to so much femininity, being feminine and all that. So what are they saying? Are they saying anything more about what they're going to do, your process, your treatment, and all that? Have you heard that yet
Yes,
or not?
absolutely. So that's why I say God is always in control, right? And I I am so blessed that at the lumpectomy, I had that done. That was done on the 16th. Um, when I met with the doctor afterwards, she was very, very pleased with the results. She seems to that she is almost 100%, if that's possible. Convinced that she got it all. She thinks she got most of it during the biopsy, but the
Okay.
lumpectomy was able to get some atypical cells that were remaining because with the lumpectomy they identify the spot where it is. They put a marker in, and that was the other thing when she did it. They
Yes,
put the
I
marker
got
in,
one.
right, and they put the marker in so that they know. So when they're going to to have the lumpectomy, it's a two-part process. The first part is you're with a doctor, a radiologist, I believe, who
Mm-hmm.
has to thread a line in your breast to show
Mm.
you where the spot is so that it's directing where the surgeon can knows where to go. So he actually puts a wire inside of you to attach it to the marker. And so
Wow.
yeah, so the surgeon again, it's like a blueprint so the surgeon knows where the spot is. And so when they do that, they take not only where the marker is, but then they take a significant perimeter around that to ensure that it hasn't spread anywhere. And if it has, they hope that they got it. So my pathology report, which came back a week later, of course, my doctor would go on vacation, right, Marilyn? So again,
Of
another
course.
waiting
Of course.
period. But with
Okay.
me, I'm nosy in these charts. I read my chart and I was reading and I called my best friend. I was like, I don't know if this is really what it says, but it does seem to think that they got everything and we're good. And I was like, God is God is in control again. He's always coming through when you need him. So she confirmed it. I had another appointment in the beginning of November, no, beginning of October, where we started talking about next steps. She wants to, Dr. Addis wants me to have another mammogram after all the tissue have healed, just to confirm that everything is that visually my breasts show what the pathology reports show. And
Okay.
then I also
Okay.
am going to speak to a medical oncologist. Just the word oncologist kind of freaks me out,
Yeah.
but I'm
Yeah.
going to stay
Yeah.
with it. So I'm going to a medical oncologist. It seems like I'm probably going to be a good candidate for hormone therapy. There's so many different
Okay.
kinds, so I don't want to mention the names because I'm not sure which one. But that's always something. Hormone therapy. Not sure about radiation yet. I'll know more, um, and then we'll see. We'll see. I mean, I
Okay.
was just, what I think is most important, if anybody gets anything from this conversation, is to be consistent with your testing. Because one of the things that
Yes.
I always think about, and I try not to go there, is if there was such a change in 6 months, what if I had waited and said, "Oh, I'm not going back in 6 months. I'm still in my bubble. I'll wait another year." It could have been a completely different story because things changed in 6 months, right? And so
Or less.
right. So you have to just pay attention, pay attention, pay attention. And you do I felt nothing, Marilyn. I still don't feel anything. Nothing.
Wow.
How would I have known that if I hadn't gone and tested? It's not like I had a lump. It's not like I had pain. I had nothing. There's no indication that anything was going wrong.
Wow. Wow.
So, and again,
That's
it,
something,
it
Jill.
is. And since then, when we start talking and we start communicating, we're open. Because initially I was like, I'm just going to keep this to myself. But then I'm like, maybe I could be blessing someone else. So now I tell my little story. But mind you, I know so many other people who've had stories that are so different. Um,
Mm-hmm.
but I tell my story because I think we as women, particularly Black women and Black women of a certain age, we're so busy taking care of everybody else that we forget about ourselves. Um,
We do.
and there are certain people in my inner circle that I wanted to make sure that I shared with them in person. And I remember one of my besties, we went out to dinner and we were talking and we hadn't seen each other in a while and we've had this conversation. And I was like, I have something I wanted to share with you. And I started to tell my story. And this was earlier before I had the lumpectomy. And I just felt like the need to share it with her. And before we could even start, I could see her body language change. She started getting a little tense.
Tense.
She,
Yeah.
her face. And I could see she was getting emotional. And I was like, girl, what's wrong? I'm good. Why are you doing that? And
Yeah.
she's like, I knew it. She said, I knew I haven't been taking care of myself, and you are here to convict me that I need to go. And she said it. We've been friends for 10 years, 15 years. She never had a mammogram. And she's a woman of a
What?
certain age, you know?
She never had one, Jill?
Nope,
Well, that's a word right there.
nope. But
If you
she
haven't
has
had one,
now,
you need to go get
but
one.
that's my point. We are so busy talking and helping other people
Mhm.
that we just put ourselves on the background. Or there's something that paralyzes us. We don't want to know. Well, I will tell you, you may not want to know, but you not knowing could change your outcome
Oh yeah.
significantly.
Okay.
It could change the outcome because things happen so quickly, so quickly. And the when as I've talked and learned and did some more research, that little bubble that I was in I didn't because I had a breast reduction surgery and I thought that I was in a different spot. Not true. I mean, there's a lot of risk factors that are out there, and there's risk factors that are in our control, and there's risk factors that are not in our control. And some of those
Right.
risk factors that increase our risk, when I looked at them, I was like, wait a minute. I have that, I have that, I have that, and I have that, and I have that. So that bubble wasn't real. And many of us have them. Are you over
That's
50?
right.
Do you need to lose weight? Are you at the ideal weight? Um, did you have your period early? Well, been
Right.
under, or did you start menopause later, which means that you have a lot of estrogen in your system? The cancer that was in my body is estrogen positive, so that means
Oh,
it breeds in an estrogen positive, or I don't even know the right
wow.
term, but estrogen
Okay.
increases the potential of growth, right? So
Right.
you have to look at that. Um, did you take birth control pills? Hello, many of us
Hmm.
did, right? So all of these factors increase your risk for breast cancer. And honestly, as much as we talk about genetics, it doesn't have to be. Like, there's nobody in my family that has breast cancer. Nobody. We had
Wow.
a couple of people after we talked have been through similar situations and wanted to have advanced testing, but they all came back negative. But nobody has breast cancer in my family. Nobody.
Wow. Wow. Well, you know what, Jill? I really like your story and I like every point that you're making. You're making some strong points about get your mammogram. One of the things that I heard, and you helped me out on this, is that I like to go to the same place where I got it the first time, the second time, the third time, because it's all about the calibration of that machine. Okay, because going to another place, uh, in my little small mind, the calibration might be off and they don't know. Have you heard anything about that? About going to the same place. I go to the same place and it's far to go, but I go to the same place every year. Okay. Because following my little scare, I said, no, I'm going. And well, you really don't have to come. I said, no, I do have to
Right.
come. Okay. I don't care nothing about insurance or whatever. I'll do a payment plan. I don't care. Put it in the layaway, whatever you want to
Right.
say. I'll do that. And that's another thing. Don't be listening to all this insurance won't pay or this, that, and the other. Insurance ain't your life, right? You know what I'm saying? You have to say, I want this anyway. And I'm always saying the same thing about health literacy. You have to
Right.
insist. Okay,
Right.
you have to insist. People talk about where you go to Google, Google don't know everything, but Google gives something in your head to ask.
Absolutely.
I would rather ask and say, stop looking at Google, stop listening to Google than not to
You are
ask.
absolutely right. You have to be your own advocate because no one else
Hmm.
will be. You have
No,
to
they
ask
will
the
not.
right questions. You have to question. And the only way you can ask those questions is by doing some independent research and finding out, the experiences of other people. The more I talked about it, the more I realized um, so many people have DCIS, right? It's one of the most common forms of breast cancer. And it varies people to people. I know so many friends who, now that I'm sharing this story with, they've had it, but they didn't find out they were at zero stage. They found out they were at two, second, two, three, four, you know. So it
Wow.
varies. It really does. And it's really important how quickly you stay on top of it. I walked in,
Yeah.
the Sister to Sister. I'm in New Jersey, Somerset County. They have Sister to Sister. It's a breast cancer support group, and
Hmm.
they're and they primarily concentrate. I'm sorry, there's something in my eye. They concentrate on Black women. And so my sorority, I'm a member of Delta Sigma Theta Central Jersey Alumni Chapter, Maryland.
It's okay. It's all right.
Um,
Go
and
ahead. Okay.
we have always sponsored this walk in October, and I've participated as, a member of the chapter, just supporting it, giving financially. But this time it was very different, being on the other side and just looking and seeing. I have a picture of myself, Marilyn. Maybe I'll share it to you and you could show it. Um, but one of the things that they do, and they do a very good job of encouraging survivors after the walk,
Hmm.
and they call survivors over. So, like, to me, I'm in the middle of where I'm a survivor, yes, but you mentioned
I think you're a survivor
that's
thriver.
exactly what you said. And so I'm going to wear that title. But I went over and I joined them. But it was so encouraging to see so many women, 5 years, 10 years, 15. I think there was a woman out there over 20 years, a survivor. So
Wow.
that shows you that even though you're going through a journey, you can, beat it if you are diligent and you take care of stuff. So how has this changed me? I'm exercising a little bit more. Um,
Okay.
I'm eating a little bit better, and I'm just trying to do Jill, because I think that um, it was either a wake up call or God wanted to get my attention.
Yeah.
And so I believe that He's got my attention.
He got it.
And
He
I
got it.
think, at this season in my life, it really is about choosing Jill. I know you where we met at the wonderful retreat, the Sisterhood
Yes.
retreat that we met in Pennsylvania a couple of weeks ago. One of the things that Teresa poured into us is that it's time to take care of yourself, right? And so I left that retreat invigorated and saying, I'm going to choose Jill. And another,
Wow. This has really been a good conversation, and you have really you brought it home. I'm just gonna say that, and I think if people hear this, they'll understand that you gotta do it. You just gotta do it. You just gotta go and get the test. And then once you get the test, be vigilant. Be an advocate for yourself, and say, well, I still don't feel good, or I still don't feel right. Something feels weird here. And also, one of the things that they don't talk about a lot is the self test, your own in the shower or wherever, laying down to see for yourself. I know a lot of women that said, I discovered this
mm,
this pea-sized lump. I discovered it. So that's another thing. So for those who are super, super scared, you can still do a breast exam on your own self and then say, hey, I need to go in on something. And I'm not trying to say don't go, but something has to be done because these girls deserve better. That's all I can say. There are girls and they deserve
yeah.
better. So
You're
yeah,
absolutely
but
you're absolutely right about that, Marilyn, in terms of knowing your body and knowing things and self-testing. But I will tell you, I didn't have a lump. So I mean, while it's great to understand your body and any changes and any transformations, all of that,
mhm,
it's also important to get tested because things are happening that you don't feel, you don't see. There's no
you
changes
don't.
in your physical change in your outer body. So you need to be able to look from the inside out. So self-testing and self-aware and those monthly, all of that, that's important. That's one key of it, but it's not it. Don't wait until you feel something.
Don't wait.
Don't wait
And you're
until you
right.
feel something.
I agree with that, and I
Yeah.
love what you're saying there. But one of the ways that I always try to get tested, I try to do it in
Mm-hmm.
October, or I'm going to do it in the love month of
Right.
February. For those who are out there listening to that, that might be the key to when you say in February, I need to love myself. In October, I need to get this done. But it still say the other months is
Yeah.
okay. But once you establish that, just
Stick
do
with
it.
it.
It's
Yep.
basically just do it. Because then also they always used to say on this one commercial that you're not taking medicine or doing things for yourself, you're doing it for your loved ones. Okay. I want to have a long life so that I can enjoy my my sons, my daughter-in-laws, my grandbabies,
Absolutely.
I want to continue to be what I call a boomer zoomer, okay? That I don't
I like
that I just keep it going, baby, a boomer zoomer, right? That's who I want to be.
that.
And that's the reason why I guess I do what I do now of saying, no, it's not over. You talked about retiring, I talk about refiring, I talk about we got so much more to give, okay? Medicine has allowed boomers to keep on going, okay? It's a long life now, longer than a long time
Right.
ago. So getting tested, doing what you need to do to make sure that you're as healthy as possible,
Absolutely.
because I always say health is wealth,
You
right?
absolutely
That's
agree.
where it is. That's
Absolutely
where it is.
agree with you.
Yeah. So, Jill, we're going to end this. And I mean, it's a great conversation chatting it up with Jill Johnson on Girl Who Don't You Know. Okay. But is there anything else that you want to add before we finish this conversation for today?
The only thing is that I'll repeat it and I said it twice. Love yourself enough to take care of you first. You can't help anybody else if you can't help yourself first. Put your own oxygen mask on first. And it's okay. It's okay to choose you. It's okay.
I love that. I'm so happy and I'm so proud of you, Jill, to come on and just go on and do the doggone thing. Okay, but listen, you have been listening to Marilyn Green. I'm the hostess with the mostest on Girl Who Don't You Know. And please like and subscribe. And I'll be coming back again with some dynamic guests, and you don't want to miss it. So until next time, we are saying peace and out.